Hey y'all. Welcome to another aspiring CRA Q and A with me. And today I know y'all are probably like, oh, it's 7 o'clock. I thought we were doing noon. Well, a lot of people reached out and said they wanted to attend live, but they couldn't because of the time. So I thought, well, let's try 7 today and see if that will help out for the people that couldn't make it at 12. And I know everybody's in different time zones. So that's another factor as well. But let me know if you can, and I'm going to give everybody a few more minutes to join before we get started, because I know I did change the time and I know I kind of switched it up on y'all and didn't give you a notice. But let me know if you can hear me, if you can see me. I think you should be able to see and hear me. Let me make sure. Um, Yeah, I think you should be able to hear me and see me. So, if you can hear me, comment one. And if you can see me, comment two. And if you can hear me and see me, comment one and two. Hey, Isosa. Welcome. If you can hear me, comment one. If you can see me, comment two. Both. Oh, Tiffany, thank you. You can see me and hear me. Lottie, hi Lottie. Welcome to everybody. And let me know where Bucky, hi, and let me know where you're joining me from today. And what your role is currently in the industry. Tiffany, Catley, Bucky, Lottie, thank you, everybody. Marianne, hi, welcome. Cashel, Octavia, Michael. Hey, everybody. Ashley. Let us know where you're joining us from. I'm in Wake Forest, North Carolina. So let me know where y'all are coming from. Tanya, Omar. I see you. Danikia. Hey, Danikia. How are you? I hope the baby's doing well. We got to catch up. Tanya, Marta, Princess. I see you're trying to get into the industry, okay? Tanya, Los Angeles. Hey, on the West Coast. Canada for Isosa. Thank you for joining. Columbus, Tiffany, data coordinator and data associate. Great. Those are two great roles to get into the CRA space. Marta, Miami. Hi. Princess, you're somewhat near me. Octavia, Georgia, CRA trainee at PPD. Nice. Chisoka, Marianne, Denver, Isosa RN looking to transition. That's perfect. A lot of companies are looking for RNs that want to transition. Ketley, New Jersey, awesome, trying to get into the industry where you're in the perfect place to be. And let's see who else. Amy, tuning in from Worcester, Massachusetts. The second post, the link is not working about the coaching program. Okay. Amy, I'm not sure what's going on with the link, but send me a direct message and then I'll send it over to you. And you can also go directly to aspiringcra.com also to get it. But if you're still having issues, just send me a DM and then I'll get it to you. And Cashel, Ontario Clinical Research Site Manager. Nice. Nice. So all of y'all welcome from around the globe and everybody that is currently in the space or trying to transition into clinical research. Welcome as well. You're in the right place. And it's 4 minutes after. So I'll give people one more minute to join. But I'm going to continue from the list of questions that we had last week. We didn't get to go through everything. So I'll start from that list. But if you didn't send me your questions yet, please go ahead and drop them in the comment so I can go ahead and add you to the list. It's a running list, y'all. So you want to go ahead and get on it because it's pretty long already. It's Sosa Jasmyn is not easy in Canada to get into the CRA space. It's also, I feel you. There's definitely different countries where there's more clinical research than others. So it can be a little bit more challenging, but you definitely don't want to approach it with that mindset because mindset is everything. So, yes, maybe that may be the case for some people, but don't even think about it like that. Like if this is what you want to do when you're serious and committed about it, you can make it happen. There's ways to make it happen. So, Ashley Gwinnett, Okay, Gwinnett in the house. Currently in the CRA Academy, leaving education. Nice, Ashley. Um, and I'm from Conyers, Georgia, by the way. Princess, I'm currently income maintenance caseworker with the Department of Social Service. So this will be all new to me, but I'm ready to transition. Nice, Princess. And I actually have some clients that I'm working with that are in your case, your exact case, transitioning over from social service into the clinical research space. So it can be done. It has been done. So stay committed. Don't give up. Okay, so now we are 5 minutes after. So I'm going to just continue. Like I said, welcome. Hey, everybody. If you didn't send me your questions already, please put them in the comments. I'll add them to the list. But for now, I'm going to keep going based off of what we didn't get to last week. So I had another question from Tania, and her second question was, I currently have 3+ years of experience in the clinical research industry. Having worked for TMF Management and Transparency Services, I believe I have a good understanding of the basis of the industry. I am looking to move into CRA roles, but I'm not sure of the skills that I need to brush up or extra knowledge that I need to possess in order to excel as a CRA. I'm coming to you in order to seek some guidance on how I can crack the CRA interview and how to establish a foothold of all the activities that CRAs does. So that's a loaded question, right? Well, for that first part, she's saying that she's not sure of the skills that she needs to brush up on and the extra knowledge that she needs. So I talked about this last week, but on my podcast is episode 22, episode 22. I go through the 10 categories that I've outlined for you guys to focus on in terms of the clinical research skills that you should seek to acquire to kind of gauge as to whether you have the right of experience, enough experience. So take a look at episode 22, and that's Confessions of a CRA. That's the name of the podcast. I'll drop the link in the comments when we get done here. But you can Google it, Confessions of a CRA, or you can search for it on your whatever podcast platform you use. We're on all the majors and most of the minor. And so that's the first part of the question in terms of the clinical research skills that you should seek to gain. And then in terms of some of the soft skills, like communication, leadership, things like that, if you take a look at any job description for a CRA position, and guys, y'all have to be mindful of the title. So every monitoring job doesn't say clinical research associate. They're kind of switching the names up a little bit. So some of them might say site monitor, some of them might say site management associate is some names that I've been seeing. I've been seeing clinical research ambassador, site management ambassador. What else have I seen? I'll try to generate a list and we can go over it. I'll include that the next time too, but be mindful of the titles. They don't always say CRA, so you have to look at the job description and the responsibilities. But if you take a look at the requirements and the skills section of the job description, that will also let you know other skills that they will be looking for, such as leadership and being a team player, things like that. So that's how you can identify the skills that you should be focusing on. And then for the second part of her question, where she asked, how can she crack the CRA interview? So that's a loaded question too. And there's no way that I would be able to cover all of that in one of these sessions. I cover it very lengthy with my coaching clients. We spend several weeks going over the interview section, the questions, mock interviews from myself, from other CRA recruiters that I have on my team that does mock interviews. So it's a very intense process. That on my end anyways, that I like to approach it as an intense process because I want everybody to be ready regardless of what they throw at you, right? I don't want you to just have like these canned coin answers that, you're reading from a script. So the best way, number one, is to practice. And of course, you have to practice the right way, right? Or else you're just practicing the wrong way and reinforcing bad habits. So I'm going to throw out there practice. But I'm going to preface that by saying, get with somebody that it doesn't have to necessarily be specifically a CRA coach. or even someone that is, a career coach or career coaching expert or anything like that, but someone who you trust that might be a friend, a colleague that does really well at interviewing. Maybe a manager, maybe a CRA, maybe a recruiter in another industry, but someone that you can get with and just practice with them. Do like a little mock interview. I always say record it and practice with them. Go over your responses to some of the more general questions, some of the behavioral questions, and get some feedback as to is this question actually answering, is your response actually answering the question? Because I find that that's a lot of people's problem, is that they go off on this tangent and they're not even really addressing the question. But is it really answering the question at hand? And then is it answering it well, in depth? Is it providing substance, or is it just a lot of fluff? So get with somebody whom you trust. And then also, okay, let's say you don't have anybody in your network. Well, number one, you got to expand your network, right? And you can do that very well here on LinkedIn. I always have my clients we're working on constantly establishing their network and building their network and nurturing it. That's going to be key to your success and your career throughout your entire life. No matter what you do, networking is key. I've met so many great people on here strictly through networking. So many people, really all the people on my podcast, except maybe I want to say like one person, maybe two, they've all been through networking on LinkedIn, y'all. So you really got to get into that. But then also there's a lot of different career coaches that do on YouTube that have interviewing videos that you can take a look at. And I'll drop some links for those people as well. You can take a look at those videos. And I'm going to put out a interview series on my podcast. That's coming soon because I get a lot of interview questions. And like I said, it's so much information, it's hard to cover. But that'll be coming soon. But in a nutshell, to really kind of like give you a quick response is, for her question is, how do you crack it? The job description. The job description is your cheat sheet. It's your best friend, and it will give you all the answers that you need. So you really want to study that job description, and you really want to highlight the key skills, the key responsibilities, the key things, the key points, the things that are repeated over and over again that are kind of like standing out bold. Those are the things that you want to make note of. So when you're responding in the interview, you want to always tap into some of those points that are on the job description, because that's their ideal candidate, y'all. That's who they're looking for. So you basically want to mirror the job description and just repeat back to them what they have listed, but obviously, or maybe not so obvious, in a strategic way. You don't want to just verbatim throw it out with no fluff, and I mean with fluff and no nothing to back it up. You want to show that you have, if they're looking for something, let's say they have that you're going to be dealing with TMF ISF reconciliation or something like that. So you can say that you were on a project where you had managed, 30 sites, and you had to conduct TMF ISF reconciliation for 30 sites within a 90-day time frame, for example. And give examples of that, and how you were able to do so. Did you have a tracker? Did you have to delegate responsibilities? How were you able to manage that task within that short amount of time? So you want to be able to, like I said, mirror what's on the job description, but in a strategic, informative way. So the job description, long story short, is how you can crack the interview. That will give you all the answers that you need, and then practice. And then she says, how to establish a foothold of all the activities that CRAs does. Again, networking. So build up your network with CRAs. Talk to them. We're our people. We're busy, but we're people. And a lot of people out here are open to helping. We want to help people as much as possible. There are some people that are just super busy and they don't have the time. So don't take it personal if you reach out to somebody and they don't respond. But guess what? There's so many other people that will respond. So just keep going. And eventually you will find somebody that you can chat with. And please, when you reach out, don't just say help. Don't just say, hey. Don't just say, can we talk? Be specific. That's another thing, y'all. You have to think about what you put in these, messages that you're sending out, because honestly, we get so many on a daily, weekly basis that you have to pick and choose who you respond to. And you want to catch their attention, right? So say something that would be like, okay, this person is actually trying. They know what they want. They have a specific question. Let me respond. But when you don't have those specific questions, it's open ended, it's vague, and it requires us to do more work and put forth more effort than you did with your question, and that's when you're least likely to get a response. So be specific. Hey, I'm looking to get into the CRA space, and I came across your profile. I see that you've had an amazing career. I would love to network. I would love to connect with you, and see if we can set up a quick chat sometime so I can learn more about the role and what you do. That's an example. That's how you are specific and you clarify exactly what you want, and you're more likely to, get a response. And also, I just want to throw out there that networking goes both ways, right? You not only want to, seek information, get information, but you also want to be a resource as well. So maybe, you don't have something to offer at that specific time, it at least on the surface. But a lot of times people, just talking to somebody, meeting a new friend, being able to help somebody, guide somebody, mentor somebody, have a conversation, and, just chat about their career. You don't know what that does for some people and their spirit, their mood, just knowing that they're able to give back, just being able to take a break from the day to day. So even you reaching out, connecting, that in and of itself could truly be a benefit to some people. So keep that in mind too when it comes to the give and take process of networking. And then I have a question, next question from Dr. Iboyini Agiteo. And please, if I'm butchering that, I apologize. But he wanted to know the job opportunities that are available in the pharma biotech industries and clinical research organizations. So that's a pretty open-ended question, and there's lots of job opportunities. Here, of course, we focus on the CRA role. There's other roles like clinical trial assistant, clinical trial associates, in-house CRAs, study coordinators. Those are the three main pathways that I always mention that people should focus on if they're looking to get into the CRA space. And then there's study startup specialists, there's data entry coordinators, regulatory coordinators, there's regulatory specialists, there's clinical trial managers, higher up clinical trial managers, project managers, associate managers, directors. There's lots of different roles in the pharmacovigilance space. There's drug safety associates, drug safety specialists. In the medical affairs side, there's some entry-level medical affairs roles that you can take on, such as they have different names, but like clinical scientist is one of them, medical affairs associate. There's a lot of different roles on the stat side, the biostatistician side. There's so many different roles, honestly, that again, it's impossible to cover them all during this session. But check out the different areas in the industry and just see what fits best for you in terms of, what do you like? What are you most interested in? And that will kind of guide you. And sometimes you honestly have to just try it out. You have to try out a role, try out a specific area of the industry, see how you like it. If it's not a good fit, then keep looking and eventually you will find what works for you. So the next question is from Dubim Okoye. And again, my apologies if I am pronouncing it incorrectly, but the question is, should I include therapeutic areas in my resume, even if I have only 5 therapeutic areas of experience? And then should the therapeutic areas have their own section? So, one of the things I want to point out is that it says, if I have only 5 therapeutic areas of experience, y'all, we got to get rid of this mentality of I only have or I just have, because 5 therapeutic areas is a lot. It's a lot. Even if you have one, a lot of people don't even have one. Some people out here are like, I just want to get in. I just want to get one. But 5, y'all, that's a lot. So to say if I only just have 5, that lets me know that you're stuck in that, I call it only syndrome or I just syndrome. And I have a podcast episode on that as well. I can't remember what it is. It's one of my latest ones. I want to say 28 or 30. But yes, we got to get out of that mentality because it's killing y'all's confidence. It's killing the energy that you bring to the table when you're searching, when you're networking, when you're interviewing. So let's get rid of only. Let's all agree today that we're going to stop saying I only have or I just have. Let's let it go. So 5 is a lot. And how should you include it in your therapeutic area? So there's multiple ways that you can do it. You can include it throughout in the job experience section, the job work history section throughout each job that you held. So you can include it as one of the bullets, but don't just say therapeutic area experience, including oncology, gastrocardiology. Don't do it like that. Again, we want to create bullets that actually add value, show your achievements, show your accomplishments, and preferably in a quantifiable way. So you want to say more than that, like manage 30 sites for an oncology phase 3 multiple myeloma protocol, global protocol. That's an example versus just saying on therapeutic area experience, including oncology. But you can include it throughout the job history. You can include it at the beginning in a summary highlights or career highlight section in the beginning with bullets. I always say no more than 5, 3 to 5. If you're going to summarize your history in the beginning, you can include it in there. And that's when you can say working therapeutic knowledge or working therapeutic experience or therapeutic area experience phase 1 through 3, including, and then list out the 5 areas. You can do it that way, or you can include a therapeutic area experience section and then you can list it out in bullets that way. So it just depends on how much information you have on your resume in total and what flows the best, depending on how much information you have. I always say resume is 1 page, 2 if you want to consider it front and back. But the CV can be I've seen CVs, gosh, that are like 40, 50 pages. They get really long. That the CV includes your entire work history, whereas the resume is tailored for that specific job and is more so includes the history, the experience, the skills that are relevant for the position that you are applying to. So that's how you can include it on your resume. And then it says, should it have its own section? Like I said, you can create a specific therapeutic area section if you would like or not. It's totally up to you. But 5 is definitely enough to have its own section. Now, if you had one therapeutic area, I would say don't make that its own section. I would say include that in the summary or include that throughout the work history itself in the bullets. So the next question we're going on is Gurab Sarkar. And this question says, how can we manage fast reviewing at site means to say increase my pace for SDV? Okay, so correct me if I'm wrong, but it sounds like you're asking me, how can you increase the pace for SDV? And for those of you who are newer to the industry and aren't familiar with that acronym, source data verification, that's what you will be doing during your monitoring visits, your interim monitoring visits as a CRA. It sounds like you're asking, how can you increase the pace? How can you SDV more pages during your visits? That's what I'm getting. Correct me if I'm wrong. So number one, I want to refer you to the ASAP course, the ASAP CRA course, and Daniel Regut, Regut. I apologize, Daniel, if I'm butchering your name. I always mess that up. But Daniel, Regut, look him up on LinkedIn. And you can also look up the ASAP CRA course. And he has an amazing course where he shows you how to better manage your life as a CRA. And this question specifically, how to increase your SDV pace. He has tips and tools and trackers and a bunch of information there in his course where he teaches you just that. But I will say that one of the things is that I'm not sure. I see that it says you're a CRA, so I don't know how new you are to the industry. But a lot of it is honestly time, patience, and practice. You'll just get faster as you get more experience. So if you're just starting out, don't worry. it honestly takes about 2 years really to get acclimated. And then, God forbid, if you move to a more complicated TA like oncology, it could take even longer than that. And then depending on the study, the indication, sometimes, it just has a lot of detailed information on each page that you have to verify. And then depending on the site and if they have, source templates that they specifically created for the study, or if you're going through a bunch of medical records, that will determine your pace as well. So some of it is just out of your control, honestly. But the things that are in your control would be to create trackers, to have reports that are listing out what needs to be verified prior to, arriving to the site for the visit. Sometimes, depending on what company you work for, the team will send out weekly reports, and that's not something that you have to do yourself. But if that's not the case, most systems, most EDC systems have some type of report platform or attachment or setting where you can generate reports within the system, and it'll spit out a list of data points that need to be verified for your sites, your patients. So that's another way too, is taking a look at what needs to be verified so that you're already aware of prior to arrival, and then making sure that any queries that were open since the last visit, taking a look and seeing what can be closed prior to arrival. Because a lot of times, especially if you write your queries in the appropriate format that will allow you to close queries without coming back on site and verifying, sometimes you can close queries and wrap up that data prior to even arriving on site. So those are a couple little quick tips, but check out the ASAP CRA course. And then, and I don't know if I mentioned this, but I'll put that link in there as well. So I need to let me write this down, my podcast link and then Daniel's course. I'll put that in the comments so y'all can check it out. And then so the next question comes from Cashel. As a CRC, which is a clinical research coordinator for those of you who don't know, as a CRC of 6 years at small sites, which with transferable skills should be my main focus when applying to in-house CRA/CRA1 roles. And she also asked, what is one of the most essential concepts to ensure you mention in a CRA interview? So for the first part of the question, y'all, going back to episode 22, and that's where I talk about the research experience that you guys should focus on acquiring, and breaking it down into 10 categories. So take a look at episode 22. Episode 18, I cover it briefly, but 22 more so in detail. And there, you guys, I list out all of the categories, the top 10 things of transferable skills that you should focus on seeking and acquiring. And if Cashel, if you have been a CRC for 6 years, I'll already go ahead and tell you that you already have all the skills that you need. I don't even have to look at your profile, your resume, your nothing. If you've been a study coordinator for 6 years, you have everything that you need to transition. So at this point for you, it would be more so figuring out how to effectively tell your unique story in a way that stands out, in a way that highlights your best assets, your best achievements, your best accomplishments, and helps you stand out. That's most people in your situation. That's mostly the problem that I see, because you have everything that you need. It typically also boils down to a little bit of mindset challenges as well. But that's it. Now you just need to work on branding and marketing yourself, packaging it all up in the best way, and sell yourself during the interview. But you have everything that you already need. You just have to figure out how to package it the right way if you've been a coordinator for 6 years. And then what's one of the most essential concepts to mention during a CRA interview? I wouldn't say that there's really a most essential concept, because it's pretty subjective. And it's going to depend on who's interviewing you. Honestly, you can have, we can both interview for the same company and have two different interviewers, and each interviewer is going to focus on something different. And it's unfortunate and it sucks, right? Because there's no standard. And some people might say it's not fair, right? Somebody might focus on something more easy, whereas another interviewer might focus on something more challenging. But if you're prepared, you don't have to worry, right? Because you're prepared. You're prepared for whatever comes your way. So make sure that number one, like I said, you're prepared, you practice, you're prepared, you don't have to worry about any of that stuff. But there's not really one concept that you should focus on. But if I had to give you any type of advice, I'm always going to direct y'all back to the job description. Again, that's your best friend, that's your cheat sheet. So whatever job you're interviewing for, whether it's a CRA job, a CTA job, a regulatory coordinator job, whatever it is, study that job description, and that's going to give you everything, the concepts, everything that you need to be focused on. Okay, next question. It's 7:30 already, but I want to try to get through a few more. And let me see, I see a few more people joined us. Nakia, hey Nakia. And Marianne, I see your question. We're going to add it to the list, Princess, as well. Hey, Keisha. Keisha is one of my clients, y'all. She is amazing. And I see Dr. Shaw. I see your question. Isosa, yours. Hey, Shay. How you doing? I don't even know you were on LinkedIn. We gotta I haven't seen you in forever. We gotta catch up. Let's see. Okay. I wanted to stop and say hey to everybody. And so a few more questions. Let me see. 7:31. Let's see if we can get through a couple more. So a shock. And again, I apologize if I'm not pronouncing your name right, but it says you're a clinical affairs specialist. So a shock question is, how difficult is it to transition into pharmacy CRA for medical device field? Now, if you haven't figured it out by now, y'all, I'm real big on mindset, getting your mind right. And that is going to really set the pace, the trajectory, the foundation for anything you do in life. So for me, I have to say, you got to stop focusing on how hard it is or what they say or what you've been told or any of that stuff, because it doesn't matter. It does not matter. And what happened to somebody else has absolutely nothing to do with you. And if you're coming into your job search, into this space with that energy, that's what you're going to get. So you have to get rid of that today, right now, quick, fast, and in a hurry, because that in and of itself is blocking you. I'm going to let you know right now, if you're having issues and you're thinking that way, that in and of itself is blocking you. You got to stop it. So for a shock, don't worry about how difficult it is. If that's your goal and that's what you want to do, then that's what you're going to do. And you have to approach the situation with that mentality, with that mindset, and just create a plan and execute the plan, take action, and make it happen. But never stop and say, how difficult is it? Because number one, how is that going to benefit you? If, okay, let's say somebody said it's extremely hard, does that mean you're going to quit? I would think not. I would hope not. So why does it even matter? If they say you have a 1% chance, if anybody tells me there's a 0.0001% chance, then in my mind, I have a chance. I don't even think about the fact that it's so low. All I need is a chance, and I will make the rest happen. And that is how y'all have to think about it. And I'm not saying it's going to be easy. I'm not saying sometimes you're not going to want to give up. I'm not saying none of that stuff. That is not even going to get hard. I'm not saying that. But what I'm saying is that can't be your focus. Your focus has to be on the goal at hand and constantly figuring out strategies of how you're going to reach that goal in spite of no matter what. That should be your primary focus. That should be your only focus. If you get knocked down, if you get discouraged, if you need to vent, please do so. Get it out, release that energy, but let it go, release it, and then come back to the table fresh and clean and keep pushing forward. So that's what I have to say about that question. Let's see if we can get through two more. So Kara asked, Kara Atkins, what about experience from other professions? How can we get employers to take a chance on us with little to no clinical experience? That's going to go back to transferable skills, Kara. So if you take a look at the job description, and I know it's challenging when you don't have somebody to help you do these things and when it's not something that comes natural to you, but there's always things in every role, regardless of where you worked, that you can take and you can show that there's a transferable connection. in terms of the skills that you acquired in that other role to the new role that you're applying to, whether it be CRA, CTA, study coordinator, whatever that may be. So you're going to have to look at the job description, see what they're asking you to have, the responsibilities that you will need once you get the role, and then take a look and compare that to what you've been doing in your other career profession, and then compare the two and show how you can connect the dots for them. Unfortunately, I have to have this conversation a lot with people, my clients. Unfortunately, we are responsible for connecting the dots for recruiters and interviewers and the hiring managers. We are responsible for connecting the dots for them. They don't always see it clearly. They don't always pick up on it. You have to spell it out for them very, very clearly. And I have to repeat that because a lot of people don't believe me. But you have to spell it out clearly. I mean, in layman's baby kindergarten terms for them. No room for any type of interpretation, misunderstanding. You have to clearly spell it out for them. And if that's not something that you're good at, that's where a coach, a career coach can come in. That's where a friend, a colleague, somebody that's already in the industry can come in. A mentor can come in. There's other ways to kind of seek, help on that end. And I have a podcast coming out. It's going to be after the interview series though, but I have a podcast episode coming out about how you can identify, make those connections, connecting the dots for them, because I know that's the challenges that a lot of people have. So once that episode comes out, I'll bring that up again, but you're just going to have to take that JD and really break it down and think about it yourself, because only you know what you've truly done within your current profession, your current and past roles, and be able to connect those dots. That's one of the things. That's one reason why I don't just do done for you resumes, and I don't just only do interview prep, and I do require for people to commit to coaching with me for at least 3 months, 12 weeks, because I need to know your entire history, your entire background, all the little things that you think don't matter, that are useless, that are pointless, that is just or only. We go through all of that because it's always something that I can use, and it's always something that I can connect and show how those transferable skills are useful and essentially the same. And it's hard for you to be able to, connect those dots if it's not something that, number one, that you're not in the industry, so you don't even understand, what it is that you're specifically going to be doing. And then number two, if that's not your profession to be providing, career coaching and strategies, of course, it's going to be a challenge too. But that's something that I really, really, we dig deep into. I get the full story so that I can help y'all, pull out those transferable skills pieces. And Kara, I'll reach out to you separately. We might be able to use you, if you don't mind, maybe here one of the live sessions as an example on to show people of how you can, use those, pull out those transferable skills. So I'll reach out to you. And then Dustin, we're going to take one more today. Dustin, and for anybody else that included your questions in the comments today, I'm going to add those to the list. So don't worry. Like I said, we're doing it every Monday. So don't worry. You're going to get in your questions. I'm going to answer them. But Dustin Motley, his question is, how do you measure or judge a startup or smaller company's chance of success or staying power? I know I can ask people who work at the company, but what is some criteria I can look up online? I would hate to join a startup that folds in the next 6 months. So Dustin, this goes back to mindset. I don't know what energy or what the intent behind your question is, but it sounds like it's coming from a place of fear, and it's coming from a place of lack. And any of my clients, anybody that knows me closely will tell you, like, you have to get rid of any type of, anytime you're operating from a space of fear or lack, it's not going anywhere good. So I don't know exactly what the intent behind the question was, but if you're saying that you want to get into the CRA space role or the clinical research space, and you have an opportunity with a startup company and you're scared they're going to close within 6 months, Don't worry about that. Your goal, your objective, your agenda should be to get any experience that you can, because as a lot of you that are probably joined have found out, it's hard to get that experience. So if you have an opportunity to get some experience, get it. And don't worry about 6 months later, because you might be offered another position or a better position within that 6 months. Might have a bigger opportunity. The company might not fold, and it might become a major big company where you can get stock. Who knows, right? But you should never let fear stop you from taking a risk. When it comes to reaching any type of big goal, when it comes to building your career and really taking ownership of it, you're going to have to take risks. But in my one of my philosophies is that there's no such thing as loss. There really is not. It's only room for opportunities and growth. That's it. And so when you take that approach in everything that you do, you're not even thinking about, well, what if they close? That shouldn't even be on your mind. If you have an opportunity and that's your only opportunity and it's going to help you reach your goal, which is also why I tell all of my clients, we create career development plans. And I encourage you guys to do the same. Maybe we can talk about that one day here in one of the Q&As. But when you have a plan, you already know your goals. You already know your objectives. You already know your mission, your vision. And it's in line with it or it's not. If it is, go for it. If it's not, on to the next. And it makes everything very crystal clear, black and white. So I wouldn't be focused on if a company is about to fold or not. Shouldn't be a concern. Your concern is this company going to help me reach my goals? Is it in line with my philosophies, my mission, my values? That's it. Nothing else matters, Dustin. So now we are 11 minutes past when the end time for today. So we have a few more questions that are on the list that we need to get through. And then I see your new questions today. So I'll go ahead and add those. And tell me, you guys, if you like this 7 p.m. time or if you prefer the noon time. And then I was also floating around 8 p.m. as well for the people that might be on the other side of the world, that it's like super early for them, because I had some people in Australia and India as well. So let me know what you think about the time. Should we go back to 12 noon? Should we keep it at 7, or should we push it back to 8? And that's all Eastern time. I'm on Eastern, y'all. So let me know in the comments, DM me if you like this time, if you would like a different time. Please keep sending your questions. You guys are asking some amazing, great questions. Please keep sending them. I love answering questions. And for those of you who are interested in learning how to, work directly closer with me, my coaching program is still open for enrollment. I'm taking on a few more clients, so you can book a call with me and we can hop on and see how I may be able to help you. And guys, I don't take everybody. So trust me, if I'm not able to help you, if I don't feel like it's a good fit, you don't have to worry. I will definitely let you know. But if I can help you, if I feel like it's a good fit, of course, I'm going to extend that offer and let you know how we can work together. So please feel free to book a call. I'll drop that link as well. And then also follow me, hit the notification bell so you'll be notified as soon as I go live, or if I, once I drop any other content, any posts, any tips. You can also check me out over on YouTube, Jasmyn Adams, Aspiring CRA TV, and then definitely check out the podcast. We release guest interviews on a weekly basis for people that are currently CRAs or they were CRAs and they've moved up. So you get to hear all these different amazing stories of how people got into the industry and how they've built and created these amazing careers. And then on top of that, I also give additional weekly tips as well. So check out confessionsofacra.com. But until next week, you guys, stay safe, and I can't wait to see you again. Thanks for joining.